Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is an overview of medial branch blocks. Back pain affects 90% of Americans at some point in life. It's the second most common reason that people see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. 10% actually end up worse than before. The cost of back and neck pain exceeds $100 billion every year. The facet joints of the back cause back pain 45% of the time. The disc is the source of pain 40% of the time. The facet joints are thumbnail-sized joints on both sides of the spine, right, left, right, all the way up and down. Okay? They do have cartilage. They're prone to arthritis just like other joints such as the hip or the knee. They're small, but they can be a huge source of pain. When you try and diagnose the source of the pain for facet joints, it involves a history, physical, imaging studies such as x-rays and maybe a CAT scan. On this CAT scan you can see these facet joints here and here. They actually look very clean. Okay? But when you look at arthritic ones, it's hard to even see the joint space. There's bone spurs, irregular joint surface, and those can be a source of pain, or they may cause no pain at all. Joints need sensation to feel pain, okay? And the facet joints receive their sensation from these nerves here called medial branches. Not the nerve root, that's what this is, but they're little branches that come off and supply the joint, all right? There's one that goes down and there's one that comes up. So there's actually two sets of medial branches, okay? These don't have any motor function, only sensory. So a medial branch block provides medication to block those medial branches. It actually is performed for two reasons. One is diagnostic purposes and the other is therapeutic. Most modern pain doctors do use image guidance such as ultrasound or fluoroscopy. Typically numbing medicine is injected. Some doctors do inject steroids, some don't. This is an outpatient procedure. You don't need sedation for this and it takes less than 20 minutes. The diagnostic portion helps pain doctors figure out if the joint is the source of the pain. If the injection works well at that level and it relieves pain, then the pain doctor can reasonably say, aha, that joint is the source of some of the person's back or neck pain. Studies show that average pain relief is over 3 months with a medial branch block, so it does in and of itself serve a therapeutic purpose. The procedure works well in 85% of patients. And if it wears off, either the person can go on to a radiofrequency ablation procedure or simply have the medial branch block repeated. And multiple levels can be done at one time. So you can do, first of all, you have to put numbing medicine in two areas, right? The upper medial branches and the lower ones, because each joint gets sensation from two sets of medial branches. Okay, but you can work on multiple joints at one time. You can even do the pain doctor can do bilateral. So as mentioned, if the medial branch block works well and then it wears off, the person can go on to have this radiofrequency ablation. Basically what's happening is thermal energy is being put through a catheter and it heats up and kills these medial branch nerve endings. Okay, not a nerve root, just a nerve ending that only has a sensory function, no motor. All right. Now radiofrequency ablation procedure can provide 6 to 24 months of pain relief. The biggest study out there showed 15 months average pain relief, which is incredible. I mean, it's a really revolutionary procedure for pain management, and it can be repeated if the pain relief wears off. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state. Over 50 insurances are accepted by the board-certified pain doctors with over 25 treatment options in play. There's an average success rate of over 90% with the board-certified award-winning doctors. Visit us at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.